Hello and welcome to the very first episode of Policy Unpacked, a podcast by Global Policy Network. In this series, we will dive into the policies shaping our world, from healthcare to sustainability to education, and explore how these critical areas intersect to drive meaningful change. Whether you're a policymaker, a practitioner, or just policy curious, we're glad you're here. Let's unpack policy together. So my name is Amina Ghazel-Sachi. I'm the founder and CEO of Global Policy Network, and I'm here with one of our advisors, Dr. Sheikh Mateen Ellahi. So hi, Dr. Ellahi, how are you today?
I'm very well. Nice to be here. Pleasure to be here, and nice to meet you once again.
Thank you. So tell us a little bit more about yourself.
I'm Dr. Sheikh Mateen Ellahi. I'm a proud father, husband, and son. Academically, I am a GP partner at Untitled Medical Center, where I oversee both clinical and operational strategy. Alongside that, I hold senior leadership roles within our primary care network, and currently also serve as an advisor on one of the projects for NHS England. I also hold a position with a local ICB, and I'm a senior advisor to several startup technological companies in the primary care sector. I've completed my MBA in global health from UCL, where now I am an industry expert as well as being on the external advisory board. My work focuses mainly on improving clinical efficiencies, safety in primary care through innovation, policy changes, and system design.
Fantastic, thank you. So at Elmtree Medical Center, what strategies have you implemented to improve patient care and operational efficiencies?
So there's quite a few actually at Untitled Medical Center. Luckily, we have a very stable team, and we've been able to grow over 1,000% over the last 7 years organically without any acquisition mergers, which we're really proud of. While doing so, we've also been able to provide the excellent patient care while being rated Google rated #1 practice in the UK. We've focused basically on both cultural and structural changes. I think on one hand, we've introduced digital tools from a digital triage pilots to smarter rota management systems. On the other, we've built a culture which we've used soft skills for, where staff feel more empowered and safe to contribute ideas. Beyond our own practice, as partners, I've been able to support other practices as well as a primary care strategic consultant, including where I helped practice from CQC, which is the quality care team, which assesses each GP practice in primary care from inadequate rating to a good rating. We focus as an Elmtree Medical Center to break down the barriers in access to care. We make sure that there's sustainability, growth, and we try to unlock additional income streams. As we know, in primary care, there are a lot of barriers in place and there's a lot of expenditure. So unlocking additional income streams has been really beneficial for us to be able to grow at the same rate that we have been.
That's fantastic. I mean, there's lots of massive challenges within primary care, and you've mentioned some of the ways that you've generated opportunities. What do you see being the biggest challenges and opportunities facing primary care in today's current state of play?
I think if you go out in the public and ask them what they feel is the biggest challenge, and at the end of the day, as doctors and clinicians, we're here to serve the local community and the patients and the population themselves. So for me, the biggest factor which the patients always say is access to care. I feel it remains as one of the, if not the biggest challenge over the last decade. The statistics show that demand is increasing, yet the number of full-time equivalent GPs or general practitioners is decreasing. On the opportunity side, I think the future looks hopeful. There is plan for new integrated neighborhood teams, which is a model offering real potential. It offers GP practices to work at scale alongside other practices within a connected neighborhood. It allows you to imagine or reimagine how care possibly could be delivered at scale. And I genuinely feel if we can get that right, i.e. collaboration, working together to provide sustainable care for our population, we could finally move away from reactive care, fragmented systems, to the ones which are proactive through collaboration.
That's fantastic. And then how do you see that impacting patient safety?
I think that's an interesting question. I think patient safety, you can tackle it various ways. Nowadays, compared to pre-COVID, we're seeing more remote consultations. There's more of a diverse clinical workforce due to several reasons. And there's higher appointment volume due to the demand, which I mentioned before, increasing. Along with having fewer full-time equivalent GPs, there are chances that clinical safety can be compromised. There have been some papers written where they've been contradicted potentially, where some papers have mentioned that remote consultations can increase safeties, and a lot of them have mentioned that remote consultations can be safe. I feel remote consultations can bring benefits, but due to the variability of workforce, remote consultations, higher demand, potentially lower supply, it can introduce a lot of variability, which we clearly see in every GP practice. And we need to just make sure that the risk of integration of consultations and digital triage systems is managed well. And if it isn't, that could increase clinical risks and have an effect on patient safety.
And how do you at Elmtree assess that? How do you mitigate that risk?
In our practice, we focus on 3 pillars. So we are very heavily data driven, and we look at data. So you can have different metrics for clinical risks. One aspect could be prescribing inefficiencies, or prescribing potentially the wrong drug, or how many times the patient has to come back for the same problem to the practice itself. The other aspect we look at is team training and open communication. And the third one is open communication. I think psychological safety is key. Soft skills are not talked about enough, we feel. And we feel the biggest way to eradicate clinical safety, or any safety for that matter, is to have open communication. We want staff to feel they are empowered, they're able to raise concerns, and they're able to raise concerns early. Doing regular audits, incident reviews, and we meet up daily with the key stakeholders, I feel helps all of the staff come together, and open communication.
And let's go to AI now, because AI is becoming increasingly important and also integrated within healthcare. How do you see its role evolving in primary care over the next 5 to 10 years?
I think AI is a word, AI meaning artificial intelligence, which is, I feel, bandied about a bit too easily and too quickly, without having a true understanding of it. I ended up doing generative AI course from Cambridge University remotely over 8 weeks, just to gain basic understanding, because I was using the word AI, but I truly didn't really know the meaning of what AI is. I wanted to get a basic understanding of what AI is, how can it be used, and even more importantly, what are the risks involved with it. So your question of how do you see AI evolving in the next 5, 10 years, specifically to primary care, I think this is a space where there's a lot of potential. And I always talk about, when I do keynote speaking, is that AI or technology is an enabler. It should aid clinical decision making. It should aid administrative work, and it should aid any triage that we are doing. But it will not, and it cannot replace clinicians. We always need humans to interpret, contextualize, and provide empathy. Where I see future of AI is mainly in digital triage systems, which are being incorporated into primary care already. There's a lot of companies that are moving into the scribe space, increasing clinical time for clinicians and removing administrative work for clinicians, thus enabling clinicians to actually see patients which they want to.
That's fantastic. Those are some great examples. And how would you see other primary care leaders just incorporating safeguarding or any key considerations when they are implementing technology and AI into primary care?
I think before integrating AI into primary care, you have clinical risks, clinical safety reports should be done, and they are done. And I, again, recently attended only 2 days ago to become a clinical safety officer. I attended a course to learn again more information about what are the risks involved, how do you do a risk assessment, because there should be a risk assessment done by the provider themselves and by the organization who might be using that medical system / device. So if you can follow follow the clinical risk assessment completely, and the two main clinical risk assessment tools are the DCB 0129 from the organizational perspective, and the DCB 0160 from the organization who might be using that tool. If you can do that, then you have a solid basis of making sure that if there are any clinical risks, they are reduced as much as possible.
Fantastic, thank you. And as you know, Global Policy Network is just 2 months old, and you are, one of our first advisors. Tell us a little bit more about your role as an advisor at Global Policy Network, and really what excites you about the mission and vision that we share.
For me, why I got involved into Global Policy Network was number one because of you, because I knew you, and I loved your energy and passion for global policy and your experience as well. And the other thing that excites me is I've been able to make small changes at a practice level for 10, 20,000 patients, but I want to do this at a bigger scale. And I feel through this network, through GPN, bringing together clinicians, and not just clinicians, but economists, policy thinkers. I haven't seen that before myself. I believe health systems, if you're looking at a bigger level, can't be solved in silos. We need collaboration. I alluded to the integrated neighborhood teams in the past as well. GPN allows for cross-disciplinary collaboration, global thinking, that should lead to a more integrated solution, not just at a national level, but hopefully at a global level.
And what advice would you give to healthcare professionals aiming to drive change in their own practices?
Good question. For me, we brought about a lot of change. I'm just going back to my MBA days. When I try and bring change at a practice level or a PCN level, I love to have a framework. And for me, my favorite framework is Kotter's 8-stage model of change. And I've used that to help bring about change. And I think having a framework kind of aligns you and I guess points you in the right direction when making change. But the key points for making change, in my opinion, are starting small and being consistent, involving the key stakeholders, and making sure that you can influence your team in a collaborative manner. You're able to speak up in the meetings, you're able to listen to the key stakeholders, you're able to review any complaints, and making sure, again, the soft skills, the culture. There is a culture for change. If there isn't a culture for change, no matter how much you push change, that change will never actually happen. And I think lastly, when you're bringing about change, don't be too strict. Be curious. Be willing to change. The best leaders that I've met are humble. Um, they're not, they're not headed in one direction. They are humble enough to ask questions and brave enough to answer most of them also.
So sometimes I find that coming from my policy background, we often look at our own local systems. We often look at our own local practices, but actually, there's a lot that we can learn. There's a lot of lessons that we can learn from elsewhere, even abroad, even across our own countries. And what I mean is that sometimes instead of just looking inwards at our own practices, sometimes it's also quite inspiring to see what people are doing in other PCNs, different ICBs, or what they're doing in Scotland or Wales or totally different countries to us. Often we have the same problems.
Yeah, no, I totally agree with you. I think I was speaking to someone the other day who was sitting in Saudi, and there's Vision 2030. They're trying to have this left change, which NHS have been talking about for the last decade as well. And putting primary care into the middle and as a gatekeeper, and they face very different challenges, but again very similar also. We should be able to learn from them if they are willing to learn from us, and there are certainly a lot of things that they're doing extremely well, extremely efficiently. So sometimes if you're working in silos and you have a tunnel vision, you're unable to really project the right skill to combat the barrier that you're facing. So I think always being open, always being collaborative, and looking outside the box, if that is outside your national NHS systems, can only be helpful.
Absolutely. And what would be your aspirations for the future of primary care in the UK?
Yeah, I always talk about this. I would like primary care to be more proactive than reactive. Simply put, and then people say, what does that actually mean? I feel every single day, most of the GP practices in NHS are firefighting. They're dealing with one day and forgetting about the next day, and then dealing with the next day when it comes along. How do we become proactive? I think it means we need to look at data, and we need to interpret data, and then we need to make sure we are able to change based on the data that we've gathered, and then re-audit the data later on. That sounds very simple. It's not. We need to make data-driven decisions. We need to have supportive infrastructure for GPs in the first place. And we need to have a meaningful space for innovation to take place. If we can have all of that, I feel there are a lot of talented GPs and clinicians, full stop, that can bring about this change.
Absolutely. Absolutely. And what can our listeners expect from you through your work at Global Policy Network?
I would love them to get to know me a little bit. I feel I can provide quite candid insights. I feel I can bring about a blend of frontline stories, as I am a clinical doctor. I do see patients every single day. And hopefully also policy thinking. I believe I have a very strong commitment to make sure that the big ideas we discuss translate into real world solutions for patients and clinicians, and I want to be at the forefront of it. So hopefully the viewers and listeners can see that from me.
Thank you. And we are launching our policy series on the future of pharmacy in the UK, and also looking at it globally. And we'll be bringing Dr. Ellahi in as a specialist in primary care and integration. We'll also be looking at other topic areas and other policy areas with him as well. So this brings us to an end. It's been fantastic talking to Dr. Ellahi. Thank you so much for your time. And join us next episode, where we're going to be talking with one of our first associates, Stephen Riley, who is Deputy Regional Chief Pharmacist and Pharmacy Integration for NHS England in the Northwest. So Dr. Ellahi, would you like to say a final few words goodbye to our listeners?
Thank you very much, firstly, Amine, and I would like all the listeners to keep up to date, to follow us on social media. We have a big mission and vision, and we would like you to join us on this journey.
Fantastic. Thank you so much. And as Dr. Ellahi said, you'll be able to follow us on LinkedIn, Facebook, Instagram. Well, you'll also be able to find a captioned version of this recording on our YouTube. So thank you everyone for your time. Thank you, Dr. Ellahi, and see you all soon. Goodbye.